1 in 3 US adults isn't getting enough sleep, and over time, this can increase the risk of type 2 diabetes, heart disease, obesity, and depression. Being well rested is an important factor in people to stay healthy. Now, how many hours of sleep do you need at a certain age? According to American Academy of Sleep Medicine and Sleep Research Society, they recommend that adults should get at least 7 hours of sleep per night. Children and teens need more. If you get less than 7 hours of sleep at night regularly, you will have diabetes that is harder to control. Lack of sleep can increase your insulin resistance, can make you hungrier overnight and make you feel less fuller next day, which is going to in turn make you more likely to reach out for junk food, which are usually high in carbs and sugar. Make it harder for you to lose weight, raise your blood pressure, and seriously increase your risk of heart attack. Make your immune system less able to fight infections and increase your risk of depression and anxiety. Sleep disturbances are under-recognized in type 2 diabetes mellitus. The most common type of sleep disturbance is insufficient sleep. People are not going to bed long enough. Irregular sleep. Also, there's a behavior when people are staying up most of the week and trying to catch up over the weekend, a behavior that is very common among adolescents and young adults. Obstructive sleep apnea. Obstructive sleep apnea affects 2/3 of people with type 2 diabetes. Its severity affects the glycemic control in people who have diabetes. More severe the obstructive sleep apnea, lower the insulin sensitivity. Insulin sensitivity refers to how well the body is sensitive to body's response to insulin. High insulin sensitivity allows the cells of the body to use glucose more efficiently, reducing the blood sugar. Now, multiple studies have shown that repeated awakenings during the night, insufficient sleep, or excessive sleep, or irregular sleep, they all promote glucose intolerance. Glucose intolerance is an umbrella term used for metabolic conditions which result in a higher than normal blood glucose levels, or hyperglycemia. Furthermore, if a person has prediabetes or diabetes, poor sleep will worsen their condition. When we delay the sleep time, there is more tendency to snack and our hormone levels change, and we have tendency for higher cortisol that leads to more hunger. So we eat for 2 reasons overnight. One for boredom, which is called hedonic eating. Hedonic hunger refers to a preoccupation and a desire to consume food just for the purpose of pleasure in the absence of physical hunger. Or the second reason is hormonal changes make us eat more. So the duration of overnight fasting affects the glucose regulation. Modifying your sleep duration can help you with better control of glucose metabolism. Hopefully you understand the impact of lack of sleep on diabetes better now and will start prioritizing your sleep. Good luck.